Hi, it's Megan. I did the effects of tobacco slash nicotine and nicotine slash tobacco. Definition is nicotine is an alkaloid made by the tobacco plant or produced synthetically. Nicotine has a powerful pharmacological effect, including increased heart rate, heart stroke volume, and oxygen consumption by the heart muscle, as well as powerful psychedelic effects. The causes, nicotine also activates as a specific part of your brain that makes you feel happy by stimulating the release of a hormone dopamine. The release of dopamine when nicotine is inhaled is thought to be the source of a pleasurable sensations you experience when smoking. Which can also include relaxation, a buzz, and a relief of tension. Symptoms, I did plus withdrawal, uh, restlessness, anxiety, sleep disorders, example insomnia, increased appetite, inability to concentrate, urges or cravings for tobacco, and diarrhea or constipation. The body's systems impacted by nicotine. Nicotine largely affects the area of the brain responsible for attention, memory, learning, and brain plasticity. In the cardiovascular system, nicotine acts as a stimulant. Nicotine causes restriction in the blood vessels. Nicotine acts as a chronotropic agent, which increases blood pumped every minute to the heart, which means greater workload placed on the heart. Nicotine causes hypertension, which is elevated blood pressure. People who consume nicotine are at risk for palpitations, a rapid heart rate, and arrhythmias. Nicotine has a depressant effect on appetite. Forms of transmission, if known. I didn't really think of nicotine of having a form of transmitting because it's not a disease that can be passed down. So I thought of two different ways. That one major way is smoking while pregnant, because smoking while pregnant increases the risk of health problems for developing babies, including premature birth, low birth rate, a birth defect of the mouth and lip. Smoking during and after pregnancy also increases the risk of sudden death syndrome SIDS. And then another way I thought of was secondhand smoke. Secondhand smoking is defined as a smoke that is inhaled or otherwise escapes into the air and can be inhaled by non-smokers, including pets. Children are particularly vulnerable for secondhand smoke, experiencing an increase in lung infections, bronchioles, worsening of asthma, and also an increased risk for SIDS. The prognosis / available treatment. I put there's no prognosis because there's not there's not a really way if you smoke you die sort of thing. So I put there's no prognosis to nicotine addiction. All sorts of things can happen if you keep smoking. You're at risk when you start, and you're so quit sooner than later. Treatment involves nicotine replacement, interventions. Antidepressants are also recommended because of the raise of dopamine and norepinephrine, which is just like nicotine does when you smoke a cigarette. Smoking ceasing agents binds to nicotine receptors, thus reducing withdrawal symptoms. Nicotine replacement therapy and nicotine gums / patches and lodges and stuff like that you can buy at the store. Positive and negative outcomes. There's not really one that stands out more than the other one. So the biggest one was there's evidence shows there's not one type of treatment that's more effective than the other ones. In the way of all forms of nicotine replacement therapy, gum, transdermal patches, spray, inhaler, and lodges are equally effective, increasing smoking cessation rates about 150 to 200%. So that's really good numbers in that aspect of trying to quit smoking for people. That's the end of my PowerPoint I did. Yeah.